Hi, I'm Dr. Venu Gopal Pareek. I'm laparoscopic, bariatric and robotic surgeon. So we are oftenly asked what is hernia, what causes hernia, what are the symptoms of hernia and what is the treatment of hernia. Now hernia is like a simple bulge in a tissue that contains it. It can be a fat, it can be an intestine through a muscle which gets split. Now what are the causes of hernia? Usually it is due to weakness and strain or a combination of both. So with aging or with obesity or with strenuous activity, the muscle tears off or causes weakening of the muscles, and then the intestine or the fat bulges through it, causing hernia. Now what are the symptoms of hernia, or what are the types of hernia? The types of hernia can be hiatus hernia or umbilical hernia or groin hernias like inguinal hernia and femoral hernias. Now what are the symptoms of hernia? Hernias can be asymptomatic or they can have symptoms in the form of just a swelling, or sometimes they can have pain, they can have swelling, they can have obstruction and cause significant pain. Now what is the treatment of hernia? The treatment of hernia depends on the presentation. If it's very small hernia, it can just be a masterly inactivity where you just keep observing, consult a surgeon. But if the hernia is increasing, then surgery is the only option. Now the surgical option depends on 2 or 3 types. There is a conventional open surgery which requires stitches, a typical 1 or 2 day hospital stay, and then you can be home. The most advanced and the best is laparoscopic surgery, where small incisions are done and a mesh is placed in the weakened part, and the strengthened muscle is reinforced with the mesh. So a laparoscopic hernia is most advanced hernia. Then now we are also doing robotic repair of the hernias. Here, because of the robot, the pain factor is quite less and the recovery is very fast.